Medical Dilemma.
Welcome back to Medical Dilemma. Before we start the discussions for the second segment, I just would like to mention our major sponsors, Makati Medical Center, St. Clair's Medical Center in Palanan, Makati, and LifeQuest Training and Consultancy Corporation. Now, joining me for the second segment is Dr. Mark Kho, from Manila Doctors Hospital. Welcome to the show, Dr. Kho.
Thank you.
Yes.
For the invitation.
Yes, thank you so much. It's a pleasure to have you here. Now, your specialty is surgical oncology. Okay, so what exactly does it cover?
A surgical oncologist is a general surgeon, a doctor who has finished general surgery and went on to have additional training in oncology.
In oncology. Okay.
Therefore, he or she would have the would have the idea of knowing which modalities of treatment that we use to treat cancer, namely surgery,
yes,
radiation,
yes,
as well as medication, or most popularly known as chemotherapy. But they're not now limited to chemotherapy. There's other types of medicines like biologic immunotherapies that we use.
I see. Now, the topic that we're supposed to focus on is breast cancer.
Right.
And you were called in as the specialist for this particular
Really, that's
issue.
because we know that breast cancer is the leading cancer site among not only women here in the Philippines, but also overall. According to our latest statistics here in the Philippines, the number one cancer or lead cancer site is breast cancer.
Breast cancer. Okay, and are there cases of breast cancer in men as well?
Oh, definitely, yes. But luckily for us men, unfortunately, we have much less of that, much less cancer. Right.
Now, what do you think has caused the prevalence of breast cancer to rise so high?
Nobody knows.
We
don't know. In fact, when you say what is the cause of breast cancer, it's not very clear yet. No? What we know, though, is that apparently breast cancer through the decades it has increased, and that's why now it's the number one cancer that we have here in the Philippines.
Now, how does an ordinary person detect? Would detect breast cancer?
Well, breast cancer is usually detected or diagnosed as a lump in the breast.
And this can occur anywhere on the breast?
Yes, any part of the breast, including the axillary tail, we call it. The breast has an extension to the axilla or the kilikili. And sometimes you can have a lump there, which can be the primary source of cancer.
So it's actually this part here?
Correct. Leading to the axilla, correct.
I see. Now, once a woman, since women are the ones that get breast cancer mostly, once a woman would detect a certain lump, what would you recommend that she do?
Once a woman detects a lump, the first thing to do is to visit a doctor.
Immediately?
Yes. Any suspicious lump in the breast entails or warrants a visit to the doctor, and then from there, the doctor can then lead you to tests or any other, or even treatment, or even what we call a biopsy to confirm the diagnosis.
Now, what are the procedures or diagnostic methods that are
in general
used to confirm?
The gold standard for diagnosing or to call it a breast cancer, in general, the gold standard is to get a tissue diagnosis, similar to most cancers. Although we can have a good suspicion or we call it a high index of suspicion that it is cancer, the definitive diagnosis is made through confirming it by getting a piece of it or the whole mass and having it examined by a pathologist.
And is that a painful process, a process that
It
you
may
have to
be,
stay in the
it
hospital?
may be, yes, it may be, but it may be as simple as just putting a needle into the mass and getting a sample. So it varies. It varies. It can be you may make a cut. We call it an open biopsy or a needle biopsy.
I see. Now, once it's established that it is breast cancer,
Correct.
so what are the next steps that a patient should take?
Again, in general, we have to understand that after the diagnosis and once a patient is staged, we call it a clinical staging. Early breast cancer, which is generally stage 1 to 3A, the best approach is still to do surgery first.
Surgery first.
Right. And followed by other treatments after surgery is done.
And when you say surgery, does it mean taking away one breast or both?
There are options, but in general, it's dealing with that breast in particular. We do surgery, we do breast surgery, mostly on that affected breast only. No? Rarely, and depending on the discussion, how the discussion goes, yes, we can do what we call a prophylactic mastectomy on the other side as well. No? But
Which is for prevention.
For prevention of breast cancer on the other side.
On the other
no?
side.
But there are pros and cons, and that entails a good discussion with the patient to offer. So in general, it's not a standard approach.
Could you mention in brief what are these pros and cons?
Well, that's another surgery. Second,
The second surgery.
yeah.
Okay.
Second, there's no definite way we can tell whether you are going to have breast cancer on the other side or not. So removing something that you don't have to be removed, that doesn't have to be removed, entails a surgical procedure that can have complications, that costs, and can produce pain, etc., and a scar. Of course, on the other side, the advantage is you'll now have symmetrical breast. No? I mean, chest. No? You won't have a breast to deal with as well, and you don't have to examine it anymore later on. But so, it's there are other things, and it has to be case-to-case basis. There are several issues that we discuss with the patient regarding what is better and what is not.
Aside from surgery, what are the other possible treatments?
As we mentioned, radiation can be an option, and giving medications. These are generally only done, however, after surgery is done.
After surgery.
If you're after cure, then generally surgery is done first, and then the other treatments are what we call additional or adjuvant treatments.
I see. Okay, thank you so much, Dr.
You're
Kho.
welcome.
Okay, it's time to take another commercial break. We'll be right back after a few words from our sponsors.
Mabilis nga.
So if I were you, I would be a lot more careful about what comes out of my mouth, especially in such a place where any fish can spread like wildfire.
When you share something to a public, you find that experience, and that experience so rich it could change other people. Okay?